Today we'll discuss a very important condition, hypertension, which is a leading cause of morbidity and mortality in our country. By definition, systolic blood pressure more than 140 millimeter of mercury and diastolic blood pressure more than 90 millimeter of mercury is called hypertension. And if your patient has systolic blood pressure, which is between 130 to 139 millimeter of mercury and a diastolic blood pressure from 80 to 89 millimeter of mercury, he is suffering from stage 1 hypertension. And if your patient has blood pressure more than 140 over 90 millimeter of mercury, he is suffering from stage 2 hypertension. Primary hypertension is the most common type of hypertension. It's found in 95% of hypertensive population. There is no cause of primary hypertension, but there are certain risk factors which predispose to hypertension, like physical inactivity, male sex, age more than 60 years, and if you are 75 years of age, your chances of having hypertension are almost 70 to 80%. Family history of heart disease and hypertension is also a risk factor for primary or essential hypertension. Uh, Excessive salt intake, obesity, uncontrolled diabetes, hyperlipidemia, tobacco smoking, and alcohol intake, and obstructive sleep apnea are other important factors which can lead to essential hypertension or primary hypertension. Secondary hypertension, although is less common, that is, only 5% of your hypertensive population is having secondary hypertension, but this is very important that once you find out the cause of secondary hypertension, you can cure your patient. So it's very important to examine the patients with secondary hypertension properly to find out the cause of hypertension in this population group so that you can actually cure your patients. In our country, the commonest cause of secondary hypertension is intrinsic renal disease, glomerulonephritis, and then nephrotic syndrome, uh, heavy metal intake, then patients having renal stone and hydronephrosis, polycystic disease of the kidney, and certain conditions which can lead to hypertension. Then there are certain endocrine conditions like pheochromocytoma, Cushing disease, hyperaldosteronism, hyperparathyroidism, and hyperthyroidism. Others, other endocrine causes which can cause hypertension. Contraceptive pills and is another important cause, and preeclampsia or eclampsia, other causes of secondary hypertension. As I told you that hypertension is a silent killer. There's no symptoms of hypertension. They, are, they just present to you with headaches and that's it. But once most of your patient comes to your hospital with complications of hypertension. They present to you with stroke, they present to you with end-stage kidney disease, heart failure, myocardial infarction, aortic dissection, or hypertensive retinopathy. It's very important to diagnose your hypertensive patient at a very early stage so that you can prevent target organ damage in your hypertensive population with proper treatment. And this can only be done if you check blood pressure of every patient who comes to your clinic with any complaint, regardless he comes to you with heart failure or chest pain or ear pain or some surgical problem or some eye problem, you have to check his blood pressure. Only then you can prevent complication in your patients who are suffering from hypertension. So early diagnosis before the complication occur is very important in hypertensive patients. It's very important that blood pressure should be taken properly. The patient should be seated with feet on the ground. The bladder size of the cuff should be proper and should encircle at least 80% of upper arm. And if you use a small size cuff, you will get a falsely high reading of blood pressure. This is nicely shown in this picture. You can see the arm resting against table at the level of the heart, and then you inflate the cuff. Once the radial pulse disappears, you start deflating it and auscultate the brachial artery. The sound when appears, cortical sound, is the systolic blood pressure, and when it disappears or muffle is the diastolic blood pressure. So I told you that hypertension is a leading cause of cardiovascular complications like stroke, cerebral hemorrhage, transient ischemic attacks, congestive heart failure, left ventricular hypertrophy, peripheral vascular disease, end-stage kidney disease. It's very important to prevent these complications in your patients suffering from hypertension. Left ventricular hypertrophy is particularly important because it is a cause of sudden cardiac death. And if your patient with left ventricular hypertrophy suffers from myocardial infarction, the size of infarct is particularly large, and left ventricular hypertrophy is also a risk factor for heart failure. Another complication, cardiovascular complication of hypertension is aortic dissection, which is a medical emergency and is to be treated on urgent basis. As I told you that hypertension is the cause of end-stage kidney disease, particularly if your patient is having hypertension and diabetes together, and if your patient of hypertension is having diabetes, the blood pressure is to be treated more aggressively. We have already discussed stroke, intracerebral and subarachnoid hemorrhage, a complication of hypertension. We have discussed retinal hemorrhages as well as the nervous complications of hypertension. It's very important to take a good history in patients with hypertension, history to find out the cause of hypertension, and history to find out whether your patient has got complications of hypertension. So a history of uh, non-steroidal anti-inflammatory drug, NSAIDs, history of contraceptive pills, it's very important. Family history of hypertension and heart disease, again very important. And then you should ask history of stroke, history of transient ischemic attack, history of breathlessness, orthopnea, paroxysmal nocturnal dyspnea, history of chest pain, and history of intermittent claudications. And then it's also very important to examine your patient properly in hypertension, examine the pulses for radial and radiofemoral delay to find out coarctation, diagnose coarctation, examination of peripheral pulses, and then palpation of carotid and auscultation of carotid for carotid bruit, very important. Examination of optic fundi for hypertensive retinopathy, also very important. Examination of cardiovascular system for signs of cardiac enlargement and heart failure, S3, S4 gallop. Again, examination of the abdomen for palpable kidneys, very important. And then you should also examine the lower extremities for edema and peripheral pulses. So, if your patient is very young, he's got a very high blood pressure which is not responding to drug therapy, you should suspect secondary hypertension. Is there a history of kidney disease? If there are target organ damage uh, with do not coincide with the level of blood pressure. For example, if patient is having a blood pressure of 140 or 150 over 100, and there is severe left ventricular hypertrophy and retinopathy, then you should think about secondary hypertension. Similarly, if your patient is having persistent hypokalemia, you should look for hyperaldosteronism. You should also suspect secondary hypertension in the presence of abdominal bruit. Or if the patient is having fluctuating blood pressure, sometimes very high, sometimes low, with tachycardia, you should rule out pheochromocytoma. If this is the stage 1 change in retina, you can see the arterial narrowing. In stage 2, there is AV nipping, nicely shown by arrow, where the artery crosses the veins. There is depression, the veins are compressed. And then stage 3, the cotton wool spots and exudate, and stage 4, papilledema. Hypertensive urgency is a high blood pressure without progressive end organ damage, whereas hypertensive emergency is a very high blood pressure with progressive target organ damage. Or patient present to you with hypertensive encephalopathy, acute left ventricular failure, acute coronary syndrome, or dissecting aneurysm of aorta. These are all hypertensive emergencies, conditions that to be treated on emergency basis. We have already discussed these risk factors again to like smoking, dyslipidemia, diabetes, uncontrolled, age more than 60, male sex, family history of heart disease, obesity, and physical inactivity, These are all major risk factors for primary or essential hypertension. ECG should be done in all patients suffering from hypertension to look for left ventricular hypertrophy and signs of myocardial ischemia. Urine should be examined for RBCs, WBCs, and casts, as well as albumin. 24-hour albumin urinary examination for albumin should be checked. Blood glucose to rule out diabetes, and serum potassium, if particularly low, you should suspect hyperaldosteronism, and you should also order serum creatinine to pick up chronic kidney disease patients. You should also look for dyslipidemias and other risk factors for coronary artery disease. The target goal for blood pressure is 140 over 90 millimeter of mercury, but if your patient is having diabetes or kidney disease, the target goal is less than 130 millimeter of mercury. And it's very important that you should achieve this target, because by achieving this target in your hypertensive population, you will reduce stroke, the average of 30 to 40%, and reduce MI, averaging 20 to 25%, and heart failure, averaging more than 50%. These are the lifestyle modifications: lose weight, stop alcohol, increase physical activity, reduce sodium intake. So, your preserved food and canned food, pizzas and burgers, we use frozen meat, as well as Chinese food contain a lot of sodium, has to be avoided. Maintain serum potassium by using plenty of fruits and vegetables. Maintain serum calcium. Stop smoking. Stop taking alcohol. Decrease time in sedentary behaviors like watching TV, busy with your cell phone, playing video games. You should increase physical activity, regular walk, biking, and playing some game like tennis, cricket. Decrease portion of sizes of meal so that you can reduce your weight. So this is summary of lifestyle changes: food, exercise, manage weight, plenty of fruits and vegetables, manage stress, stop alcohol and smoking, and you must also cut dietary salt intake. This is what you should take to control your blood pressure. The drug of choice are ACE inhibitors and angiotensin receptor blockers. According to the latest guidelines, these are the drugs of first choice. In elderly population, you can use calcium antagonist and diuretics. Methyl-dopa is the drug of first choice in pregnancy, because in pregnancy, ACE inhibitors and angiotensin receptors blockers are contraindicated. So if your patient with hypertension is having heart failure, use ACE inhibitors and diuretics. If your patient suffering from hypertension is also suffering from myocardial infarction, use beta blockers and ACE inhibitors. And patient who is having hypertension and diabetes together, use ACE inhibitors and ARBs as first line antihypertensive medications. Resistant hypertension is a commonly used term. By definition, the blood pressure targets not achieved by using at least 3 drugs in optimum dosage, and one of these drugs has to be a diuretic. In these patients, if the blood pressure is not responding, you should take the history of non-steroidal anti-inflammatory use because that make the hypertension resistant. You should also ask your patient whether he is taking diuretic or not because it is mandatory in resistant hypertensive cases. You should also ask your patient whether he is taking medications properly, and if he is not taking drug properly, what is the special reason why he is not taking, whether it's to cost of drug or there are too many pills, and then you should sort his problem. To make your patient more compliant to take medications, I think you should use combination therapy instead of using too many drugs because patient if you write too many drugs in your prescription, patient will not take it. The best combination is ACE inhibitors and diuretic combinations or calcium antagonists or ACE inhibitor combination. So combination therapy should be your best first option in your hypertensive population. Thank you very much. That was all about the management of hypertension. And in the next presentation, I will discuss with you the heart failure and its treatment. Thank you.